Dr. Micah, thank you so much for joining us on the Plant Trainers podcast.
Oh, thank you so much for having me. I'm honored to be on your podcast.
We would love to know if you have a moment of gratitude to share with us and our listeners. What are you grateful for today?
I am grateful for just being alive and at home with my family and not being in the hospital right now, given everything going on.
So that means that now, at the time that we're recording it, you're not frontline, you're not working in the hospitals and all of that. Is that what you mean?
Yeah, I'm not
Yeah,
directly in the hospital right now, and I'm
right.
not sick in the hospital also.
Right. Yeah. I mean, yeah, two big things, and I know that you're still doing lots of great work from where you are, and just being here today and recording with us. It's going to give so much information to people today.
Mhm.
So we're very excited to be talking to you. And you we have a lot of friends in common, which is great. Which is how we
Mhm.
found you, plant-based doctors. We love that, and we love to have you have a moment to shine on the Plant Trainers podcast. Why don't you tell everybody a little bit about how you got into medicine and how you found a plant-based lifestyle?
So my journey into medicine didn't start until after college. I went to UC Riverside for college. I graduated as a business major out in Southern California. I figured that I want to help people. I didn't really want to work in the corporate world, but I didn't know exactly what path I want to take. So I did work in the volunteer in the physical therapy department, worked as a pharmacy technician, volunteered in the hospital. And really, finally, it really came down to what really challenged me the most, was the most satisfactory. And I figured out that would probably be medicine. So applied for medical school, ended up going to medical school in Chicago, where I was there for about 4 years. And then made my way to residency in internal medicine out in Southern California, where I'm at right now, Loma Linda. And currently, I am a rheumatology fellow, meaning I am specializing in autoimmune diseases and arthritis. And it's a 2-year fellowship after a 3-year internal medicine residency. So that's where my journey into medicine is. And my journey into medicine also was inspired by my own disease. I had arthritis at a very, very young age. I went on a high protein diet. Back in high school, I was a football player, American football player, a bench warmer. I wasn't starting, but I was chubbier. I was about 160-ish pounds. I was on the heavier side. I want to lose weight. I want to get stronger. And at that time, the Atkins diet was very, very popular. So I went on a variation of the Atkins diet, ate about 200 grams of protein a day, protein shakes, milk, fish, red meat, chicken, whatever would feed the protein. And from there, I did this for probably a couple months and I ended up getting a big toe pain in the middle of the night. I felt like someone just got a slab of wood and it just slammed my foot in the middle of the night. So I woke up unable to walk and I was diagnosed with gout. Um, Gout is a very, very painful condition. I couldn't walk to school. I limped to school. I've suffered for many years, and over time, my disease changed. I didn't really change my dietary habits. I lived the college lifestyle, partied, hanged out with friends, drank alcohol, and things just got worse from there. And then my disease eventually went from just one joint to multiple joints. I couldn't really understand what was going on. I went to different specialists. I went to rheumatologists because they're the arthritis doctors. They said, yeah, you have gout, but we really don't know what else you have. All your labs are negative, but your inflammation numbers are high. So finally, I went to the rheumatologist where I did residency, and they said, "Look, let's take a look at the ultrasound, see what's going on." They found some inflammation near my tendons, and they found different joints that correlated with maybe a certain pattern. So I eventually was diagnosed with spondyloarthritis as well, which is another autoimmune arthritis. Gout is not autoimmune disease; it's just a form of arthritis. And I was also diagnosed with pseudo gout as well. They put a needle into my joint and they drew fluid out and they saw crystals. That's how you diagnose gout and pseudo gout. So I was basically given three diagnoses: gout, pseudo gout, and spondyloarthritis. And that inspired me to go into rheumatology because that's what rheumatologists treat, and I can understand what patients go through. Um, And going how I got into the plant-based lifestyle was I watched Forks Over Knives 2 years ago, and because my wife got me into this journey first. She was ambassador of the American College of Lifestyle Medicine. She was part of the American College of Lifestyle trainees as a resident. So she got exposed to it first, and then she said, "Hey, why don't you try this out?" So I read How Not to Die by Dr. Michael Greger, and then watched Forks Over Knives. I was like, "Hey, let's just give this a shot." And within 2 months, my joint pain started slowly going away. And then by 3 months, I got labs, and one of my inflammation numbers went completely negative after being positive for 10 years, and my joint pains completely went away. So that's where it went.
What was the first course of action that they gave you when they told you you had rheumatoid arthritis? How did they tell you to deal with that? Did they give you medication, or what was the process?
Yeah. So just to clarify, I don't have rheumatoid arthritis. It's spondyloarthritis, which is similar but different. But both are autoimmune disease conditions. And they told me, why don't you try this medication, methotrexate or hydroxychloroquine, which is very hot today for the coronavirus. These are the medications they recommended me. I was like, no, I don't want to try it. Even though hydroxychloroquine has a low side effect profile for in rheumatology, I didn't want to. I wanted to try it with lifestyle and diet, even though I didn't really find a solution for over 5, 6 years. Because I noticed when I ate certain foods or drank certain beverages, it would make my pains worse, or when my stress levels were higher, it made my pains worse. So I knew there was a pattern out there, but I never really explored and dug deep into if there was a perfect diet out there. But luckily, I found plant-based nutrition, and it worked for me.
It sounds like you tried to manage it by taking things out of your diet that was making it worse, but not putting things in that would actually make it better, or taking out the things that left you at kind of like a tolerable state, right?
Exactly. And I wasn't very consistent with that. If I saw something that was appetizing, I would still eat it.
You got to walk
Food
around
is addicting.
blindfolded. Yeah.
Yeah.
Food is addicting.
Food is
for
addicting.
sure.
Yeah.
Yeah.
And in medical school, we don't get much nutrition training. That's why you see a lot of doctors out there that don't really give nutrition advice, or give very general or misinformed nutrition advice, because we don't get enough of that.
And a lot of people don't have the awareness to how food is actually impacting their body. They don't recognize that, oh, I eat this food and it makes me feel badly, or I eat this food and it makes me feel well. And people really need to pay a little more attention to the foods they consume and how it makes them feel. So how did you find that awareness?
I found that awareness just trying, like when I drank coffee at Starbucks, I would notice it made my pains worse the next day. Or if I ate more processed food, it would make my pains worse the next day as well. But I didn't know what kind of foods would make it better. Never really researched it. Thought I knew everything that I needed to know from medical school. And when I did want to know about nutrition, I didn't know where to go. There was no one at my medical school or residency that would say, guide me to the right direction.
I wanted to know, what is the major differences between the spondylosis and the rheumatoid arthritis for people who kind of want to understand that more?
So rheumatoid arthritis, there are certain patterns that we look for in rheumatology to differentiate the different diagnoses and different labs. So in rheumatoid arthritis, there's two labs we look for: the rheumatoid factor lab and the CCP, or citrullinated antibody lab. Those don't have to be positive all the time to be diagnosed with rheumatoid arthritis, but it helps. And usually in rheumatoid arthritis, it affects the hands, the first two knuckles of the hands, and it can affect the wrists, the feet as well, and the knees. But the way to differentiate that from spondyloarthritis really affects the last two digits of your knuckles on the hands, of the fingers, and also affects something called the emphyses, which when it's inflamed is called enthesitis, and that's the connection point between the tendon and the bone. That gets inflamed, and that doesn't really get inflamed in rheumatoid arthritis. And in spondyloarthritis, you can also get something called uveitis as well, which is eye inflammation. We look for diarrhea, and we look for also the X-ray patterns as well. So, and also there's a gene called HLA-B27 that comes back positive a good portion of the time when you do have spondyloarthritis, and that's not positive in rheumatoid arthritis.
So someone at home who knows that they're having inflammation, knows that their hands hurt, the difference is pretty small in terms of them being able to diagnose themselves. But when they go and get these tests, then it's pretty clear.
Yeah, so sometimes it's even hard for us rheumatologists to differentiate because sometimes the lab can be positive, but it's a low positive, but their pattern is more of another different arthritis. So it's rheumatology. They call rheumatologists the detectives in medicine. We're the specialists of the general doctors, and we're usually the last ones to be consulted in medicine because there's all these vague symptoms, and doctors can't figure it out. They look at the other specialists first, and then finally they come to us, say, "Hey, this is a mystery. What is the diagnosis here?" And sometimes it's hard for us to diagnose. So really, we have to put everything together and just come up with something. It's very difficult at times.
I hear a lot of people say my cholesterol is a little bit high, but it's still in range, or this is very low, or my thyroid's low, but it's still in range. And these ranges are averages, right? They're not a range for me. My optimal could be low, could be high, could be in the middle, but these ranges are, if a doctor says, yeah, you have some symptoms, but your thyroid's in range, or this test is in range, somebody could still be quite sick, but they're overlooking that because the average population is okay with that number. Is that kind of how it works?
Yeah, so these averages of these labs that are quote unquote normal are more from studies from the general population. So each individual is different, like you said. So what's optimal for you might not be optimal for somebody else. So if you're let's say your lab normals are normal, but you're still feeling symptoms, you might be positive. But that goes more into functional medicine. Allopathic medicine doesn't really agree with that. So I mean, it's a gray line. Maybe things will shift in the future, but who knows? But in rheumatology, when we do see a negative lab, we consider that negative.
And then what about people who may have had symptoms, maybe they had their feet or their hands were kind of cramping up, or they had some joint pain, and then they found a plant-based diet and they started eating plant-based and things kind of went away, but they kind of sneak back. If somebody were to go for a test after a year or so, or even longer, of being plant-based and not having the symptoms like they did before, will these tests still come back negative because their inflammation markers are so much lower because of the way they eat, and then we won't be able to diagnose and know how seriously they should be taking the whole food plant-based diet or inflammatory foods and things like that?
That's an excellent question. So there's certain labs that you can test for inflammation, such as the C-reactive protein and the ESR. Those sometimes they're high for unknown reasons, and we can't tell. In obesity, it can drive those up as well. But if you have an autoimmune disease such as rheumatoid arthritis or spondyloarthritis or lupus, and you want to see, hey, is my inflammation high? Because I went on the whole food plant-based diet, is it better? You can get those two labs done. But different autoimmune disease, you can also get other labs, such as rheumatoid arthritis, you get like the CCP antibody and the rheumatoid factor antibody that I talked about. Sometimes those can go negative as well, even though they've been high. Once you change your lifestyle and you get better. I know if you talked about lupus on your podcast already, so those labs can also get better when your lupus gets better as well.
Yeah, so if you don't have a marker from before because you never got tested before, and then you go, whole food plant-based, then you have no benchmark, and then you might be caught in limbo. But if you don't have symptoms, it doesn't matter.
Exactly. Yeah. Yeah, you don't want to go digging for something that you don't have.
Exactly.
So I want to just come back to the food for a minute. When you found the plants and you started eating more of them and the inflammation started going away, what foods specifically did you find that were contributing to the reduction of your inflammation? And do you now share that information with your patients?
Yeah, so I would say fiber. fiber is the number one thing that I noticed that really helped me. But it's the overall package, the day-to-day lifestyle, what you eat every day, that really made an impact on me. But fiber is the number one a nutrient that's the most important because that affects gut health. And gut health is tied directly to immune health. And fruits and vegetables, I noticed help tremendously because they have the phytonutrients that also alters the immune system as well. Brown rice, black rice, grains, oats, lentils, beans, they all affected me tremendously in a positive way. So I eat everything that I don't stay away from carbohydrates. People are scared from carbohydrates. I look for carbohydrates. I don't count carbs. I don't count protein in my diet. I don't even count the fiber. But if there was one thing I would count, it'll be the fiber day to day. I emphasize fiber because it really is anti-inflammatory. So are the phytonutrients in fruits and vegetables. They're anti-inflammatory. And I do emphasize that to my patients. I was like, hey, this is my story. I got better with my diet and my lifestyle. You can do the same, but you have to work for it. So going from someone that's a carnivore, going whole food plant-based next day is very difficult for my patients. I noticed that some of them did it. They went completely 180, and in 1 week, they went back the opposite way because they couldn't handle it. So I tell my patients, let's work on a plan. Let's start cutting out certain foods first that are highly inflammatory and go from there. And once you start feeling better, then we can it'll be more addictive for you to eat these foods that are more nutritious for you, and then you'll build up momentum. Eventually, hopefully, you can reverse your autoimmune disease just like I did, but it's not guaranteed.
How much do you find that a tablespoon of oil here and there or a vegan cookie once a week or twice a week affects your inflammation overall and your client and your patient's inflammation overall?
Mm-hmm. So I would say a little bit of oil probably won't hurt you that much. It really depends on the individual. It depends on the genetics. And it depends on what else they're doing in their lifestyle. Are they exercising? How's their stress level? Are they sleeping right? Are they smoking tobacco? Are they doing drugs? All of these lifestyle factors play a tremendous role. So a little bit of oil once a week, probably a patient might not see an effect. But again, it depends on how strong their autoimmune disease is and how strong their genetics is. Because I have patients that flare every week, that keep going to the hospital every month. And I have another patient with the same lifestyle that eat the same foods, inflammatory foods, and they're doing just fine on medications. So it really depends. So, I mean, I'm sure you've heard of people that have smoked their whole life, eating a very, very inflammatory diet, doesn't care about what they eat, whether they smoke or not, and they never get disease. That's like 1 in a billion population. You hear those stories. So genetics do play a role in this. So I would say, you know what, I tell my patients, if you want to have oil, then olive oil might be the best one. But I emphasize to them, you can cook without oil. I tell them I cook with water as much as I can at home. I bake things, I roast things, and I try not to use oil.
We've been doing some online cooking courses, and we had a group of people who weren't anywhere close to plant-based or whole food plant-based. And they're like, well, why are we putting in the onions? What about the oil? Like, they had the oil out on the counter. And I'm like, no, I didn't tell you to bring oil to the counter. Like, and we went through that you can cook without oil and how, they're like, well, what is the problems with oil? And I think a lot of people don't understand. And I think most healthy people can tolerate some, right, without having big problems. But for the people who have been sick in the past, for some people absolutely can inflame you a lot, and for others it's totally doable. I was looking through your Instagram and I came across Sjögren syndrome, and I thought that was so interesting. You had a big picture of a tongue, and it was kind of piecey and a lot of deep grooves in it, and I had to cover the picture while I read what you wrote, but I found it so interesting, and that's an autoimmune disease that I haven't heard about before. Can you tell us a little bit about that?
Yeah, that's so that picture I showed you was from a textbook, and that's more of the extreme version. I've seen it in my patients as well, but usually it's not that extreme. So what Sjögren's syndrome is, it's an autoimmune disease that attacks the salivary glands of so let's say your parotid gland or your submandibular gland. Glands that produce saliva, but it can also manifest itself in different ways. You can get it can attack your lungs. It can give you eye inflammation. It can give you joint pain as well. So all the autoimmune diseases I talked about, they're just not limited to that one symptom that I talked about. It's a systemic inflammation. So Sjögren's syndrome is also systemic inflammation. You have two antibodies that we test for, such as called SSA and SSB antibodies. And when they're positive, we're more likely to say the patient has Sjögren's syndrome. So just to sum it up, it's an autoimmune disease that attacks the salivary glands, and that gives you dry eyes and dry mouth because you have glands in your eyes as well that produce lubrication, and it can attack there as well. So patients, they may have to take medication, but whole food plant-based diet can also help this as well.
So what are some of the other symptoms that would come along with it? Would they lose their taste? Would they lose their smell? Would they have to make their prescription stronger for their glasses? What happens there?
Yeah, so as far as the mouth is concerned, they can lose all their teeth much easier. They can get cavities much easier because you need your saliva to help fight the bacteria in your mouth, and they have difficulty producing that. And also sometimes their eyes are very painful because it's so dry. And sometimes it can make their eyes worse. So I do refer them to an ophthalmologist, an eye doctor, when they do have eye involvement. And they usually, my patients are pretty mild, so they just put eye drops lubrications every couple hours to help with that. But when you do get dry eyes, dry mouth, it's not always just Sjögren's syndrome. Cancer can cause this, infections can cause this, your medications can also cause this. So a lot of things have to be ruled out in order for Sjögren's syndrome to be considered. So I've had patients die from Sjögren's syndrome because it affected the lungs so bad, and they end up being on a ventilator in the ICU, and nothing really helped it.
How is it affecting the lungs?
It's because it's a systemic inflammation. It's a whole body inflammation. So it basically causes inflammation in the lungs, and it causes scar tissue in the lungs, and the lungs don't function as much or as good as it was before. And patients just end up not able to breathe anymore.
So what's the best way for people to battle systemic inflammation?
Yeah, the best way is to eat your fruits and vegetables. A whole food plant-based diet is the foundation to this. And also all the lifestyle factors that I mentioned earlier: exercise, sleep, avoiding drugs and smoking, and improving your stress levels. Those all affect the immune system. There is more and more research coming out that sleep plays a huge role in the immune system. Exercise also does it, and also avoiding all those risky substances that I talked about.
So you mentioned stress. I think you should ask that stress question that you wanted to ask him.
Yeah, so one of the patterns that I've noticed amongst clients, amongst friends, family members, what have you, is that people will lose a loved one or get into a car accident or be quarantined in their house with their children when they're not used to it. You know, big life events happen, and then 6 months, 8 months later, you see people coming out with hormone disorders and autoimmune disease. And from what I can almost hypothesize and what I've read a little bit is that these are sometimes sitting dormant in the body or working a little bit, but because of healthy lifestyle, we're kind of keeping it under wraps and we don't feel it. But then because they're affected by stress, whether that's physical stress or emotional stress, these symptoms and these diseases start to grow and start to come out. Is this something that you see? Are you hypothesizing this, or is there science to back it? And as we go towards the 4th, 5th, 6th months of coronavirus breaking out in North America, do you think that there's going to be a spike in autoimmune disease amongst the population?
Yeah, so autoimmune disease is half genetics and half environment. So environment is everything that we talked about earlier, including stress. So without the genetics, you cannot have autoimmune disease. Now, stress, I've noticed that it does make my patients flare. So I had a patient that had a loved one pass away, and she just started flaring. Even though she was eating better, she just went the opposite way because of the stress levels. And I've had patients that went through a divorce and their stress levels just went through the roof, and it didn't matter how good they ate and what medications I was putting them on. They just were flaring. And why does this happen? There's a lot of new research coming out, but there's something called epigenetics that we need to know about. Epigenetics is control of gene expression. So you can change the way your genes are expressed through your lifestyle. So food is one, but stress is another one. So yes, I do expect to see in the next couple months after this coronavirus battle is over, that we're going to see more and more diseases coming out, such as autoimmune disease, endocrinologic disease, other diseases that are manifested by lifestyle factors, which is a lot of diseases actually. And it's unfortunate, but that's why working on the mental health is so important. We're going to see a lot of PTSD in our healthcare workers because of so much death that they're seeing. And they're going to need help. So any way to decrease the stress level, whether meditation is your way to release stress or reading the Bible, whatever your religion is so important. And exercise decreases stress level as well. So food is just one component. That's really important, but all the other lifestyle factors are equally just important.
Yeah, and I think that brings us back full circle to when you were eliminating some of the foods that created more inflammation in your body, but you weren't taking out the ones that were kind of keeping the inflammation at bay, and you weren't putting in the good ones that were going to conquer it. You know, food definitely, the second you put something to your lips or swallow it, can definitely affect you in a negative way. And all of this other meditation and exercise and stress reducing and praying and whatever it is, we don't necessarily see how much it affects us because the lack of it doesn't make us spike. But when we do it, it really does make a big difference overall in our health.
Exactly. And a lot of people are in denial, or they don't want to change their lifestyle because they're so comfortable. It's the standard American diet is the standard way for a lot of people. And it's unfortunate. So, I mean, I'm glad that people are starting to at least wake up to this. A lot of doctors are starting to wake up that the lifestyle does play a huge role here, and we don't exactly need medicine all the time to reverse our diseases.
If somebody thinks they may have an autoimmune disease or is recently diagnosed, what can they do immediately to get them on the right path to overcoming it?
Yeah, so a little bit of everything that we've talked about, but let's just focus on diet here. I think cutting out dairy is the absolute number one thing to cut out. I've noticed that some of my patients, they cut out dairy, nothing happens, but they haven't cut out everything out yet. I've had a patient who just cut out dairy, was still eating meat and all the other inflammatory foods, and the joint pains just greatly improved just off dairy. I think each individual has a specific trigger that makes them worse, even though there's so many inflammatory foods out there. So cutting out dairy. Then next I would cut out processed food, and then red meat, and then chicken. And if they have to, then they can eat fish, but I recommend cutting out fish as well eventually also, and just sticking to a whole food plant-based diet, which is basically vegan without processed food. I think that's how I sum it up to my patients. But some patients, even though they go on a whole food plant-based diet, they're still flaring, and that's where I think functional medicine comes in, where you look at chemicals, toxins, how their environment is. Heavy metals can possibly play a role as well. And I'm getting trained in functional medicine as well right now, just to give a complete plan to my patients, because I've seen that whole food plant-based diet sometimes doesn't work, but it works in a lot of the times.
It's all very fascinating. Autoimmune disease affects so many people on this planet that your work is so important, and thank you so much for doing that. If people want to reach out to you and connect, where would you like them to go?
Yeah, so in order to connect with me, I'm on Facebook and Instagram. I'm under the handle My Autoimmune MD. I'll be eventually coming out with my own website on autoimmune diseases. I'll be working in Newport Beach, California, starting this July, and I'll be doing telemedicine as well across state lines. So if they want to reach out to me, they can just find me on those social media handles, and we can get connected.
Very cool. We'll put those links in our show notes at planttrainers.com.
Thank you so much for being on the Plant Trainers podcast today. We're so excited about the work that you're doing, to see, so many up and coming plant-based doctors, young doctors who are going to be influencing other ones, and just seeing how we're all working together to make this world a better place. Thank you so much for the work you're doing.
Oh, and thank you as well for having this podcast, to reaching an audience that needs to hear this. You guys are doing amazing work putting all this together. We as doctors just can't do it alone. We need you guys as well. So I really appreciate your work. Thank you so much for having me.
Thanks.
Thank you.